Question 1. A nurse is caring for a patient with a stroke who suddenly becomes unresponsive. What is the priority action? A. Perform a sternal rub. B. Call the rapid response team. C. Check for blood glucose. D. Elevate the head of the bed. Answer: B. Call the rapid response team. Question 2. A stroke patient has difficulty understanding speech. What area of the brain is most likely affected? A. Occipital lobe. B. Frontal lobe. C. Wernicke's area. D. Cerebellum. Answer: C. Wernicke's area. Question 3. A patient is admitted with suspected stroke. Which diagnostic test should be completed first? A. Chest X-ray. B. ECG. C. CT scan of the head. D. MRI of the spine. Answer: C. CT scan of the head. Question 4. Which activity by the UAP requires immediate intervention by the nurse? A. Assisting a stroke patient to eat while lying flat. B. Offering fluids to a stroke patient with thickened liquids order. C. Repositioning a stroke patient every 2 hours. D. Helping a stroke patient to the bathroom with a gait belt. Answer: A. Assisting a stroke patient to eat while lying flat. Question 5. A nurse is caring for a stroke patient who has difficulty controlling emotions. What term describes this? A. Expressive aphasia. B. Hemianopia. C. Emotional lability. D. Neglect syndrome. Answer: C. Emotional lability. Question 6. Which lab value is most important to check before administering TPA to a stroke patient? A. Blood glucose. B. INR. C. Sodium. D. Hemoglobin. Answer: B. INR. Question 7. The nurse observes that a stroke patient has trouble forming words but understands commands. What is this called? A. Global aphasia. B. Wernicke's aphasia. C. Expressive aphasia. D. Receptive aphasia. Answer: C. Expressive aphasia. Question 8. A stroke patient with dysarthria is at risk for what complication? A. Skin breakdown. B. Aspiration. C. Seizure. D. Bradycardia. Answer: B. Aspiration. Question 9. What is the most appropriate action for a nurse when feeding a stroke patient with left-sided hemiplegia? A. Place food on the left side of the mouth. B. Use a straw for all liquids. C. Place food on the right side of the mouth. D. Feed the patient while they lie on their left side. Answer: C. Place food on the right side of the mouth. Question 10. A patient recovering from stroke says, "Nothing will ever be normal again." What is the best nursing response? A. You need to stay positive and avoid thinking like that. B. Let's talk about what you feel has changed. C. Everything will go back to the way it was. D. I think you should focus on your therapy. Answer: B. Let's talk about what you feel has changed. Question 11. A nurse finds a stroke patient with increased confusion and right pupil dilation. What should the nurse do first? A. Take a full set of vital signs. B. Notify the provider immediately. C. Administer acetaminophen. D. Reassess in 15 minutes. Answer: B. Notify the provider immediately. Question 12. A nurse notices that a stroke patient's speech has suddenly become slurred. What is the priority action? A. Check for blood pressure changes. B. Perform a swallowing screen. C. Notify the healthcare provider immediately. D. Elevate the patient's legs. Answer: C. Notify the healthcare provider immediately. Question 13. Which member of the healthcare team is most appropriate to evaluate a stroke patient's ability to swallow? A. Occupational therapist. B. Physical therapist. C. Speech-language pathologist. D. Registered dietitian. Answer: C. Speech-language pathologist. Question 14. Which observation indicates a stroke patient is adapting well to homonymous hemianopsia? A. Frequently bumping into walls on one side. B. Reading without turning the head. C. Scanning the environment actively. D. Ignoring food on one side of the tray. Answer: C. Scanning the environment actively. Question 15. What is the most appropriate action when a stroke patient's spouse becomes overwhelmed with caregiving? A. Recommend counseling or caregiver support resources. B. Tell them to take a break and come back later. C. Encourage them to stay positive. D. Suggest they contact the physician. Answer: A. Recommend counseling or caregiver support resources. Question 16. A nurse is preparing discharge instructions for a stroke patient. What should be included for fall prevention at home? A. Use soft slippers indoors. B. Install grab bars in the bathroom. C. Limit use of mobility aids. D. Remove all lighting at night to improve sleep. Answer: B. Install grab bars in the bathroom. Question 17. A nurse receives handoff on 4 stroke patients. Which one should be assessed first? A. New onset confusion and restlessness. B. Scheduled for physical therapy in 30 minutes. C. Needs assistance with feeding. D. Complains of mild leg numbness. Answer: A. New onset confusion and restlessness. Question 18. What should the nurse monitor for in a patient with a left hemisphere stroke? A. Impulsive behavior. B. Visual neglect. C. Difficulty with language. D. Denial of disability. Answer: C. Difficulty with language. Question 19. Which finding indicates effective rehabilitation progress in a stroke patient with hemiparesis? A. Muscle rigidity and increased spasticity. B. Passive range of motion only. C. Standing with assistance using parallel bars. D. Inability to bear weight on affected side. Answer: C. Standing with assistance using parallel bars. Question 20. What is the best nursing action when teaching a stroke patient with mild cognitive impairment? A. Use long sentences to explain tasks. B. Provide written instructions and repeat them. C. Rely solely on verbal teaching. D. Limit repetition to avoid frustration. Answer: B. Provide written instructions and repeat them. Question 21. A nurse observes a stroke patient coughing frequently during meals. What is the most appropriate action? A. Suction the oropharynx. B. Notify the speech-language pathologist. C. Offer water with each bite. D. Switch to a full liquid diet. Answer: B. Notify the speech-language pathologist. Question 22. A patient who had a stroke is found wandering into another room. What is the nurse's best response? A. Redirect the patient calmly and reorient them. B. Administer a sedative. C. Restrain the patient to the bed. D. Call the healthcare provider immediately. Answer: A. Redirect the patient calmly and reorient them. Question 23. Which nursing assessment is a priority for a stroke patient receiving enteral feedings? A. Oral temperature. B. Residual urine volume. C. Bowel sounds and gastric residuals. D. Pedal pulses. Answer: C. Bowel sounds and gastric residuals. Question 24. A nurse is caring for a patient with a brainstem stroke. Which assessment finding is most critical? A. Inability to move the left arm. B. Visual field deficit. C. Irregular breathing pattern. D. Slurred speech. Answer: C. Irregular breathing pattern. Question 25. Which discharge teaching is most important for a patient who experienced a hemorrhagic stroke? A. Increase vitamin K intake. B. Limit fluid intake to prevent pressure. C. Avoid activities that increase blood pressure. D. Stop taking antihypertensive medications. Answer: C. Avoid activities that increase blood pressure. Question 26. A stroke patient is receiving rehab therapy. What goal is most appropriate for early rehabilitation? A. Restore full function to affected limb. B. Maintain current level of dependence. C. Prevent complications and promote independence. D. Focus solely on speech recovery. Answer: C. Prevent complications and promote independence. Question 27. A patient with a stroke has trouble recognizing objects. What is this condition called? A. Apraxia. B. Agnosia. C. Hemianopsia. D. Dysphagia. Answer: B. Agnosia. Question 28. A nurse is assessing a stroke patient. Which finding requires immediate intervention? A. BP 148/86. B. Sudden onset of vomiting. C. Facial asymmetry. D. Mild right-sided weakness. Answer: B. Sudden onset of vomiting. Question 29. A stroke survivor expresses feelings of uselessness. What is the nurse's best initial action? A. Encourage involvement in daily care activities. B. Change the subject to a lighter topic. C. Tell the patient recovery takes time. D. Refer to spiritual care. Answer: A. Encourage involvement in daily care activities. Question 30. What instruction is most important for the nurse to give the UAP caring for a stroke patient with dysphagia? A. Position the patient upright during meals. B. Crush all medications and mix with juice. C. Feed the patient quickly to prevent fatigue. D. Allow the patient to drink through a straw. Answer: A. Position the patient upright during meals. Question 31. A stroke patient is recovering from left-sided weakness. What is the best mobility aid to promote independence? A. Walker with 2 wheels. B. 4-point cane. C. Wheelchair with footrests. D. Gait belt and 1-person assist. Answer: B. 4-point cane. Question 32. A stroke patient is prescribed heparin. What is the nurse's priority before administering the dose? A. Monitor sodium level. B. Measure urine output. C. Review activated partial thromboplastin time. D. Check potassium level. Answer: C. Review activated partial thromboplastin time. Question 33. Which outcome best indicates effective teaching for stroke risk reduction? A. I will check my blood sugar monthly. B. I will stop taking aspirin if I feel better. C. I will quit smoking and exercise daily. D. I will drink red wine to thin my blood. Answer: C. I will quit smoking and exercise daily. Question 34. A patient reports numbness and tingling in the arm. What is the nurse's first action? A. Apply warm compress. B. Reassure the patient. C. Perform a focused neurovascular assessment. D. Elevate the arm. Answer: C. Perform a focused neurovascular assessment. Question 35. What is the best strategy for communicating with a patient who has receptive aphasia? A. Speak loudly and clearly. B. Use gestures and visual cues. C. Repeat the same phrase multiple times. D. Write detailed paragraphs. Answer: B. Use gestures and visual cues. Question 36. A stroke patient asks, "Why am I always tired?" What is the best nursing response? A. You should sleep more during the day. B. Stroke recovery requires more energy than usual. C. That's not a common symptom of stroke. D. You need to try harder to be active. Answer: B. Stroke recovery requires more energy than usual. Question 37. A nurse is preparing to assist a stroke patient out of bed. What is the safest initial step? A. Move quickly to build confidence. B. Assist the patient to sit on the edge of the bed. C. Lift the patient under the arms. D. Pull the patient forward by the gown. Answer. B. Assist the patient to sit on the edge of the bed. Question 38. A stroke patient with right hemispheric damage is unaware of their deficits. What is the nursing priority? A. Provide education about stroke pathology. B. Encourage self-reflection on limitations. C. Implement safety measures to prevent injury. D. Delay rehab until awareness improves. Answer. C. Implement safety measures to prevent injury. Question 39. What dietary change is most appropriate for a stroke patient with hyperlipidemia? A. Increase red meat intake. B. Include fried foods for added calories. C. Add leafy green vegetables and whole grains. D. Focus on low-sodium frozen dinners. Answer. C. Add leafy green vegetables and whole grains. Question 40. A nurse receives report on 4 patients. Which stroke patient should be assessed first? A. Complaining of fatigue after therapy. B. Sudden new onset facial droop. C. Asks to skip breakfast due to nausea. D. Has not had a bowel movement in 2 days. Answer. B. Sudden new onset facial droop. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.